Hi everyone, it's Jacqueline Plant with OCH back again for another tips and tricks video. So today I'm going to tell you a little bit about health insurance. Okay, so you may be asking yourself, why would we want to talk about health insurance? Well, I'll tell you why. So, primarily, knowing a client's health insurance status is key to understanding their eligibility for services, which I'll go over in a bit. But spoiler alert, I'm not only talking about doctor's visits and healthcare. So, if a client doesn't have health insurance, then we want to identify this early on so that we can assist them in obtaining it, which could in turn unlock access to other really valuable resources. Secondly, capturing insurance information, including Medicaid status, helps us to understand who we are serving, and it supports the continued growth of Olympic Connect. The Washington State Healthcare Authority, which is one of the organizations that invests in this work, uses this information to help advance equitable access to whole person healthcare across Washington state. So, taking a moment to document this information ensures that we can demonstrate the impact of our work and continue connecting community members to support. So, it's very important. Let's go into C2C for a quick demo on insurance documentation. Get out of here and go over here. Okay. Okay, so quick disclaimer, I am in the training environment right now. So this is a test client and none of this is real, but this should align with what you're seeing in the production environment as well. So right off the bat, I just want to point out that you should know if there is insurance documented for your client because it will be shown in the top of the client's profile on the right-hand side right here. There's a little preview of the insurer up here. So you should see that right away and know if you have something there or not. If you want to look at this or update or add insurance information, you'd click on the trustee edit icon right here, and then navigate to the insurance tab, which is kind of right in the middle here. Here I can see that the insurer and the end date are listed, which is great. And honestly, all of the information that I really need. If your client provides additional information or gives you their insurance card to add that in, it's great practice to get it all documented. But really, the only required field in this section is this insurer field right here. So if nothing else, if you just have the insurer, that's great. And that's all that we need. But I will say that end date can also be helpful, just so you have visibility into when they might need to re-enroll, and that might be something that you can support your client with. If the client doesn't have insurance or doesn't know what their insurance status is, then you can and should document this as well. So you can select, let's see here. You can select decline to answer, asked but unknown. I think down here, uninsured, unknown. So even just putting that in there counts as documenting your client's insurance information, and that's valuable information for us to have. Let's see. The important thing here is to enter the information that you do have, and then to update it when new information becomes available. So the other thing I wanted to point out is that you may notice that a client who previously had no insurance information suddenly has it added to their profile, and you weren't the one that added it there, and you're wondering maybe where it came from. The reason for this is because the team at OCH is looking up and updating the Medicaid status for every single enrolled client every single month. It's as big of a job as it sounds like. We divide and conquer, but again, it's a funder requirement and really important work to support the hub, so we got to do it. So keep an eye on your client's insurance info. If you're unable to get it from them, it might suddenly just pop up there, and that'll be good information for you to have. If your client has a goal to obtain health insurance, or maybe a team member of OCH sent you a message to tell you that your client's insurance has recently lapsed, this is an incredibly valuable and usually pretty obtainable service that you can help them with. If your client's health insurance goal is met, then definitely use that opportunity as a chance to get their information documented in their profile. Okay, so Now for the fun part. Oh, one more thing I guess I'll mention here is that you can add multiple insurance. So if their family member has different insurance, their dependents, or maybe they have private insurance, multiple private insurance, you can add multiple here and it will just give you an additional field to fill out. So you can add as much as you want. Okay, so now something really exciting I want to show you. So let's say your client has Molina, which is what this client has. It's one of the Medicaid MCOs or managed care organizations. So let's see what kind of cool resources and services might be available to him because of that. So if you navigate to the resource directory, I'm going to start with my, let's see. Active. I'm going to search for resources and services that are offered by Molina because I know that's what my client's enrolled in. Of course, there's multiple listings here. I'm not sure if that's how it is in production, but just to be safe, I'm going to put them all in there because I'm not sure which one the resources are tagged under. Okay. So let's see. Here I can see there's 9 listed here in the resource directory, and check out what they are. So like a free Boys and Girls Club membership, free breast pump, free glasses, free cell phone service, re-entry support for those coming out of jail or detention. Lots of really amazing and maybe unexpected resources. Yeah, free cell phone service. Okay, so I recommend saving a filter for each of the MCOs or managed care organizations so it's easy to find services to offer to your clients who are on Medicaid. So because I already did this and I have all of the possible Molinas in here, I'm going to just Molina resources, save that. And let's just try one more while we're in here. So, and let's try United. Let's try WellPoint. Okay. Again, there's multiple in here, so I'm just going to put them all down just because I don't know which one is the best one to use. Okay. Okay, so once again, I have all of these incredible resources that I can offer to my clients. So this one has rental assistance, pregnancy support services, free glasses, fitness and healthy lifestyle services. So it looks like there's like a gym membership voucher, fitness coach program online. All really amazing resources that maybe your client doesn't know that they have access to. So if your client is enrolled with one of the MCOs, maybe select a few of these resources and pin them to their profile to discuss with them. A lot of what's offered is free and definitely provides some kind of relief from financial strain. So it's a great way for you to support your client right away. And of course, if you're actually referring your client to any of these resources, they want to access the resource, please be sure to actually complete the referral in C2C attached to the client's case, as this is another important data point for us and our funders. Okay, well, that's actually all that I have for you today. So I hope that you'll find this a handy tool for your client support toolkit, and please don't hesitate to reach out with any questions. Thanks. Bye-bye.